Hi, I'm JC, and I'm here to talk to you about the development of Medicare. What exactly is Medicare, and what was the objective to be accomplished in forming a policy of Medicare? Well, Medicare is a federal health insurance program that pays for hospital and medical care for the elderly and certain disabled Americans. Foremost among the improvements made in the Social Security program during the Johnson administration are the comprehensive health insurance programs for elderly Americans. Lack of adequate protection for the aged against the cost of health care was the major gap in protection of the social insurance system in 1963. Meeting this need of the aged was given top priority by then-President Lyndon B. Johnson. His administration, and a year and a half after he took office, this objective was achieved when a new program, Medicare, was established by the 1965 amendments to the Social Security program.
Stakeholders and its process. The importance of engaging stakeholders is critical in maintaining the integrity and credibility of our federal health insurance program, Medicare. The stakeholder process involves the individuals affected by decisions and implementation of benefits. For this federally regulated health insurance program, stakeholders include legislators and their staff, members from the governor's office, Medicare leadership, providers, and consumers. The strategy of the stakeholder process is to identify influential individuals who can assist with program rollout and build sustainability. These influential stakeholders can also provide feedback and identify areas of refinement by offering new initiatives. Additional strategies of engaging stakeholders include regular communication efforts, as this strategy allows stakeholders to serve as a key contact, allowing them to receive current information on the program's successes and failures in an effort to build support for the program. Communication with state legislature retains the ability to influence the program's design and budget allocation through the legislative cycle. Effective stakeholder support also includes sharing outcomes for which often are meaningful to all involved. Lastly, coordination, implementation, and evaluation with other state agencies, such as the Department of Healthcare Services, in an effort to promote collaborative care relative to the effective delivery of the Medicare program is vital. If interested in becoming a stakeholder, we have partnered with Centers for Medicare and Medicaid Services and developed a program called the Accountable Care Collaborative, which is an initiative that builds on the infrastructure, resources, and provider network. This program connects members with providers, community, and social services to help meet their needs and improve health outcomes. Information on stakeholder meetings in your area can be found online at www.gov.
Hello, my name's Anita. As you all have heard, Medicare is a vast and complicated federal funded program for any American 60 years of age and the disabled. California plays a huge role in keeping the Medicare program operating. There are approximately 40 million people receiving Medicare benefits nationwide, but California has the largest number of Medicare beneficiaries of any state, with 4.5 million enrollees. In Fresno, there are more than 40,000 Medicare recipients. We know that it takes years to pass a policy into law. This is why California must work closely with legislatures and policymakers to keep this federal program running. Thank you.
Hello, my name is Santiago. The Medicare system was implemented because of the social and economic issues, inadequate and unaffordable health care coverage the elderly were subjected to prior to 1965. Since its implementation by President Lyndon B. Johnson, Medicare has provided affordable, quality health care for the elderly and some disabled Americans. Careful considerations by all stakeholders have enabled this program to continue its service for almost 5 decades now. If individual states and the federal government work together, this vital program will likely continue to provide millions of Americans with the health care coverage they require to live longer, healthier lives. Thank you.